Global Communities have been in Ukraine for a number of years on the development side, working on local governance, through which we worked with local communities all across the country. When the full-scale invasion began in 2022, we really felt that that was a good way for us to leverage and work on localization in our humanitarian response. Localization is possible from the beginning of the conflict. It just requires adaptation. We submitted our proposal with much less detail than normal. Instead of specifying exactly the activities, locations, and partners, we provided a range and a scope of what we might do depending on partner interest. In the process of our partner selection, instead of identifying the partners that maybe had the most expertise in child protection, we really wanted organizations that were motivated to get into the humanitarian sphere in response to the expanded crisis, or were interested in getting more expertise in child protection. This was a slightly different approach for us. It also allowed us to target women-led organizations and really prioritize some of the organizations we felt were missing in the response. And we do have the benefit in the localization approach that people are already invested in the community. We really rely on our staffing to be dedicated, motivated, but also have a lot of information. They know who they're working with, so that is a good starting point. The co-creation process then took place instead of one kind of comprehensive approach across our project, targeting the big, highly populated areas. We really worked with these smaller organizations to target gaps, fill service needs, support where existing government infrastructure was not able to implement at that time. So we shared those options with them. They shared with us the community needs, and together we agreed on what their scope of work would be and where they would be operating. One of our objectives was to make sure that partners could then get funding from other organizations. A great success for us would be if they no longer needed our funding and they could get it more directly from donors. We also worked with each of the partners on a capacity strengthening plan, which was tailored, so not a one-size-fits-all. We did identify that there were key things that all of them had to have: knowledge of humanitarian principles, working on the child protection minimum standards, child safeguarding, but then we really wanted each of them to identify what their objectives were with their organization. We really worked parallel with the capacity strengthening and the implementation, which is also a challenge. But that allowed us to start implementing Respond to Children's Needs. At the same time, we can implement capacity strengthening with our partners. There are some things that are not negotiable. Our compliance is still flowing down to them. So financial, administrative, operational, procurement, these are all still things we have to work on with them. And when you have a dozen partners who are very new to this context and these requirements, it takes a lot of work. We do have to make sure that the implementation is high quality, and finding a balance between what is required and what we might discuss with partners that they can adapt. But ultimately, it means that we have better programming and we're really responding to those niche needs.